Welcome to another video. This video we will discuss what is pharyngitis. So pharyngitis is actually a feeling of scratchiness and pain in the pharynx, also known as sore throat. Pharyngitis is of two types. First one is acute and the other is chronic pharyngitis. Acute pharyngitis is characterized by pain in the throat. Dysphagia is when you eat, then you feel pain in the throat. Then fever, but fever is mild. Malaise, headache, fatigue, and rarely you can see the swelling of the palatine tonsils as well as swelling of the soft palate, swelling of the uvula, and also you can observe cervical lymphadenopathy, but it occurs rarely. So what are the causative agents that can lead to acute pharyngitis? These may be viral, these may be bacterial. Viral agents are Coxsackie virus as well as Epstein-Barr virus and many more. While the bacteria that can lead to this condition are Streptococcus and diphtheria. Streptococci and diphtheria are the most important. So I have told you the clinical features and causative agents. So what is the treatment for this condition? First we do conservative treatment. And this treatment consists of warm saline, gargles, bed rest, drinking plenty of water, and analgesics. Specific treatment consists of specific antibiotics. For example, in case of streptococcal infection, we give penicillin 2 lakh to 250,000 units, or if you are allergic to penicillin, then erythromycin is given. In case of diphtheria, we give erythromycin. Chronic pharyngitis is the type that occurs for a longer period of time, and in this case there are several different causes. For example, associated structures like infections, recurrent infections in the nose, recurrent infections in the sinuses, environmental pollution. If the person breathes through mouth, that is, he has any disease, for example, adenoid hypertrophy, in which he breathes through mouth, then it can also lead to chronic pharyngitis. Furthermore, there are some psychogenic conditions in which the person tries to clear his throat by hawking, and it can also lead to injury to pharynx and can lead to chronic pharyngitis. There are several other causes that can lead to chronic pharyngitis. For example, irritants like cigarette smoke, etc., that can lead to chronic pharyngitis. So it is of two types, catarrhal and hypertrophic pharyngitis. We should not go to that much detail. But in case of chronic pharyngitis, there is hypertrophy of the pharyngeal mucosa as well as hypertrophy of the submucosal glands, and follicular nodular hypertrophy also occurs. In some cases, pharyngeal muscles also show hypertrophy. So what is the treatment? First, we identify the underlying cause, and then the main treatment is, if a person tries to clear his throat through hawking, then you should counsel the person to avoid hawking as much as possible so that he does not cause injury to his pharynx. Furthermore, we use Mendel's paint that prevents the pharynx from any injury, and therefore chronic pharyngitis can be treated. There are so many other options that are used to treat chronic pharyngitis. Warm saline gargles in the early morning routinely are one of the best treatments that are prescribed for chronic pharyngitis.